right, so Jersey City doing its part to support some of the most vulnerable members of the community. Jersey City Mayor Steve Fulop is expanding services aimed at getting the homeless through the COVID-19 outbreak.
Yeah, he's here now to tell us about all those services. So good morning to you, Mr. Mayor. We do appreciate you joining us this morning. So first and foremost,
thanks for having me.
Yeah, of course, there are 85 cases, as we know, in Jersey City as of yesterday. Any updates to that? I understand that there are some police officers now testing positive.
Yeah, so we have two police officers that have tested positive. We have 16 in quarantine. We have about 45 that are out of work with symptoms and 24 that have returned. So it's definitely hurt public safety. We're readjusting deployment, but we are fully staffed and we are answering all the calls. So we're managing. And then on the 85, that has increased from yesterday. So we'll give a more formal update later today, but we are seeing, issues at our hospitals around capacity.
If you know the number now, can you tell us the number now?
I think the number was 101 last I heard.
Okay, so it has increased. There's so many pockets that need addressing. Let's talk a little bit about the homeless population there. You tested out those free showers, that program for the homeless population about, 6 months ago. Now in wake of this crisis, you're restarting the program. Give us an idea where those are located.
Yeah, so there's one located in the central part of the city and then one on the south side of the city. And we're just trying to provide more resources for the homeless community, the most vulnerable. And we're trying to provide extra beds for capacity issues at our shelters. So we partnered with 3 of the hotels in Jersey City, and we have 200 additional beds. We've put 50 people there as of yesterday. And the way the program works is that when you use a shower or you come to us for shelter, we also provide you a care kit, which you see there, which is 4 days of food and toiletries and sanitary items, so that we're working with the most vulnerable to kind of try our best to keep them safe.
Yeah, I think that's very important to know that they are being cleaned after each individual use. I also understand that you're making an announcement today about the budget loss that Jersey City is expected to make here. A lot of cities feeling this impact here today. So what can you do? What can you tell us about the budget in Jersey City and what you're doing to really protect so many of the residents and businesses? It's a loaded question.
So, a lot of people are talking about the impact on the state level and governors needing help, and it's important to understand that trickles down to the local level. We're anticipating about a $70 million budget hit to Jersey City, and that's because of we have a hotel tax, a payroll tax, we have all sorts of revenue items, and then we have issues around property tax collection now that we anticipate. So $70 million is not a small number for a municipality in New Jersey. And we're going to need some serious help from the state and federal government. It's really tough times.
Is the stimulus package that was just passed overnight, is that going to help you at all?
It's unclear right now. I've been working with a group of mayors and the U.S. Conference of Mayors to advocate for direct money to municipalities. As it stands right now, I thought that we were not included in that, which is problematic. And so we're talking to our congressional delegation and our senators to try and make sure that we are included as this goes forward. $70 million is a lot of money to residents here that are already going through hardship.
We have heard from the president talking to you real quick. We got to go real quick. He said he would like to see things reopened by Easter time. We're just getting a feel from officials right now what they think of that timeline.
Well, look, I think the first thing you need to do is get more testing. It's hard to kind of make a determination on when you're going to open without testing. If you determine to open without testing, it undermines everything the government's telling us up till now. It means that it wasn't as serious as people said. So how do you trust people? And if you do open without testing, it means you're putting economics in front of healthcare. So I think the most important thing at this point is to push more testing and not to push for a date that is not actual based on science.
Mayor Fulop, appreciate it.